All right, everyone, welcome to chapter 12. So this chapter is going to focus on a subfield of psychology called developmental psychology. And as I hope you picked up as you read the chapter in the book, developmental psychology really does cover the entire lifespan. And I think that catches a lot of students off guard because I think there's a misconception by most students that developmental psychologists just study infants and children. But in actuality, developmental psychologists are concerned about the influences that impact development throughout the life. So here you'll see that the textbook is going to start with conception and then touch on a few topics that are, I would say, a little bit more specific to children, so cognitive, moral, and gender development. But then we are also going to touch on some other areas that are more specific to adolescence, adulthood, and then even later in life issues. So again, I think there's kind of two misconceptions or two things that get lost in terms of talking about developmental psychologists. The first one is this word lifespan. So as I just said, researchers within the field of developmental psychology tend to specialize in one particular area. And I would say the most common area is that kind of classic school age children age range. But there are many developmental psychologists that study adolescents, adults, and even the elderly. So make sure you understand that and can appreciate the range of ages that are covered by the subfield of developmental psychology. The other thing that's kind of, I would say, glossed over or maybe misunderstood by students is the second half of this definition here, that we're not just interested in things like parenting, for example. How does parenting impact children? That certainly is something that we're going to talk about and is an interest of developmental psychologists, but it is not the only interest. There are, in fact, I would say, an endless number of things that we could talk about that impact how people develop across the lifespan, including things like culture, genetic predispositions, experiences with peers. And so the list really goes on and on. And so we're just going to focus in on a few areas of development and try to cover a few different age ranges. But this really is a much larger subfield of psychology than I think most people give it credit. So let's start with the kind of first step along the way in terms of the lifespan. So talking about conception and how development can be conceptualized prenatally, the textbook throws out this word maturation. So by maturation, we mean the sequential unfolding of genetically influenced behavior and physical characteristics. Essentially, what's happening in the womb that's impacting how the sperm and ovum come together to create a zygote, which then eventually will divide, implant in the wall of the uterus, and then further develop into a fetus, which then becomes a baby. So, as your textbook says, prenatal development begins at fertilization. And I don't mean that in a controversial way. I know there's a very politically charged conversation about, when does life begin? And that's not what we're talking about here. Instead, we're talking about from the perspective of a scientist who wants to understand things that impact the development of what eventually becomes a newborn. We're talking about that begins at fertilization. So again, once the sperm unites with the ovum, and forms a zygote. So that's what we're talking about when we say kind of the beginning stage of this lifespan perspective. And so, in terms of the kind of pre-birth factors that developmental psychologists are interested in, well, one of them is the prenatal environment. So we're talking about anything that's happening within the womb that would then impact the development of the fetus. So that could be things like does the mother have a medical condition? What are the genetic predispositions that she contributes? What is she eating? Is she using drugs? Is she being exposed to any toxins? Is she exposed to any viruses, something like the coronavirus or influenza? We also have to be kind of mindful of things like any stress or any kind of mental health issues that might come up for the mother, because that can also impact the prenatal environment. So, for example, when a mother who's, a mother being exposed to stress could impact cortisol levels, which research has shown could eventually impact the long-term mental health of the fetus, even later into adulthood for the fetus. But, we also have to consider that the biological father also has an important role in terms of the kind of prenatal development and then young childhood development in terms of things like genetic mutations. So we know that Older fathers, for example, are more likely to have genetic mutations that could impact like risk for autism or schizophrenia. And so, as I hope you're picking up on that, developmental psychologists really are interested from conception on, because a lot of things that come up, again, from the very beginning, from fertilization, can impact how a baby will eventually develop and can impact later life issues. So moving on from talking about the prenatal environment, another thing that comes up very, very early in life in terms of impacting development is this concept of attachment. And just kind of generally defined, we're talking about a very strong, intimate, long-lasting bond. And so if you've ever, watched a movie that shows someone in labor, or, you yourself has had a child, or know someone who has had a child, you know that one of the first things that happens after you give birth is they, give the baby immediately to the biological mother. And, often what they'll do is encourage the mother to lay the baby on their chest, often so there's skin-to-skin contact. And so that very much relates to what we're talking about here. This kind of general idea that one of the most important things that needs to happen very early in life is that the parents need to establish a very strong bond, emotional connection with the baby. And so this really grew out of a lot of different studies. It was kind of a long process within the field of developmental psychology to understand the role of this long-lasting bond. And so it started with the monkey study done by Harlow, which, your book does a great job of describing. But essentially going into that study, one of the main beliefs in the field of psychology was that the important role of a parent was to provide food, that it was more of the tangible aid, that was the important thing that the parent did for the child. But in actuality, what the monkeys showed was that whenever they felt fear, they didn't hang or cling to the fake monkey that fed them. They were very drawn to and climbed on the monkey that was wrapped in the soft towel. And so this shows this idea of contact comfort, that one of the most important aspects of that kind of initial, first couple of weeks of life is that the parents need to establish an emotional bond with the child. And so, this is really highlighted and shown in the field of developmental psychology based on the level of anxiety that young children feel when they're separated from their parents, their caregivers, and we call this separation anxiety. And I can tell you as a clinical psychologist, in many children, this goes past the age of 2. They're often, 4, 5, or 6-year-olds that are just absolutely inconsolable when they have to be separated from their parents. And I do want to pause and note that there are huge cultural differences, that, if children are raised in a situation where there are a lot of different adults around them, or, a lot of children around them, they tend to have lower levels of separation anxiety. But many children do experience separation anxiety between the ages of 6 months and 2 years, because that bond is so powerful and so strong that any separation from those caregivers is viewed as, highly distressing to children. And so really the kind of, ground shaking moment in the field of clinical psychology was the Mary Ainsworth Strange situation. And so this was a series of studies where they put children in different scenarios to see how they would respond. And so, one of the scenarios is, a parent and a child are in this strange room, and a stranger walks in and sits down, and the researchers look to see how the child responds. Sometimes the parent would then leave them alone with the stranger. Sometimes the parent leaves the room and leaves the child alone. There's no one else in the room. And so it's all these different scenarios where the researchers are interested in how the children react or how they cope with that situation. And so they actually use this scenario called the strange situation to see how what type of attachment style the child has with their parent. And so, are they absolutely a wreck and can't be consoled? Do they even notice that the parent is gone? Sometimes the child just keeps playing and just doesn't even care. Is it more of the child notices, looks upset for a second, and then is fine? And so there's a range of reactions the child can have. Some are more problematic than others. And so they actually use this to classify the type of attachment the child has. What's really remarkable is that there's been a lot of follow-up research to this particular study. And again, it was a series of studies that showed this. But the follow-up research has shown that the attachment style that the child has actually impacts them long term. It impacts their resiliency. It impacts how confident they feel, their level of self-esteem. And so I think it's just really interesting to consider that something that, starts to form just moments after birth, again, that bond, that emotional relationship, that can actually impact us, so much later into life. So attachment has been a really fascinating and really a focus of the field of developmental psychology for decades. All right, so let's shift gears from talking about attachment to now talking about cognitive development. Now, the name that is kind of credited as getting us off and running in terms of talking about cognitive development is Piaget. And Piaget's theory really focuses on the fact that children are constantly being exposed to new information, and they have to make mental adaptations to deal or to process that new information. And so the kind of two main processes that occur are assimilation and accommodation. So assimilation is where the child's going to take the new information they are seeing or hearing and absorb it into their existing knowledge. Accommodation, on the other hand, is where they have to modify the existing knowledge they have to try to respond to the new information that they are observing or again, hearing. And so an example of this would be, let's say there's a child who's seen, lots of dogs in their few years of life, but they've never seen a German Shepherd. So when they first see a German Shepherd, they're probably going to have to assimilate that new information into the existing structure they have, right? They probably look at that dog and say, okay, 4 legs, ears, long tongue, he's barking. Okay, he seems to be a dog. And so they would assimilate that into their existing information about dogs. But the first time they see a cat, that's going to require accommodation or changing the existing information or knowledge they have, right? Because the cat looks a lot like a dog, probably has some similarities to a dog, but it isn't a dog, which means they have to create a new category and therefore accommodate for new information. So in addition to this kind of general theory of how children mentally adapt to new information, Piaget also proposed a 4-stage theory of cognitive development. So the first is the sensorimotor stage, which is from birth to 2 years old. So this is where an infant's going to mostly be learning through concrete actions. So if you've ever handed an infant a set of car keys, the first thing they do is they put it in their mouth. And the reason they're doing that is they're essentially trying to learn, right? They're trying to assess what it is. Does it taste good? What's going on? And so their thinking is essentially involving bodily movements of looking, touching, and again, putting things in their mouth and sucking on it and grasping it. So the major accomplishment that a kid makes during this age range is what we call object permanence. And the lack of object permanence is what makes peekaboo such a fascinating game for kids, because the minute you're out of their line of sight, they actually think you disappear. Like they legit think you're gone. And so the major accomplishment from birth to 2 years old is that a child will learn that even if you can't see something, it still exists. So from ages 2 to 7, we get the pre-operational stage of cognitive development. So this is where the kid's going to start to acquire language, write lots of new words, asking lots of questions. They're not going to be able to engage in abstract reasoning, but they're going to start to develop some more kind of symbolic thought. They tend to be egocentric, but you'll see as your book talks about, Piaget was probably a little bit off the mark, that they're not quite as egocentric as he claimed. But by egocentric, we mean having a hard time seeing and understanding somebody else's perspective. They also can't grasp conservation. So that's why, if you take a liquid from a short glass and pour it into a taller glass, kids tend to think that the liquid actually grew or expanded or is more than when it was in the shorter glass. And so as they get kind of past the pre-operational phase, they start to acquire the understanding of conservation. 7 to 12 years old, thinking is still very much concrete, not super abstract, but they do start to get more complex concrete thinking, so they can categorize things, they can put things in order, they do understand conservation. And then, of course, the last phase, which is more adolescence into adulthood, that's when we start to see abstract reasoning. They can take other people's perspectives, think about the future, engage in critical thinking.